to hear it from a doctor's perspective, what exactly is this drug doing to so many people?
There's a medicine called Remdesivir, and this medicine was developed by a company named Gilead. It was actually developed to treat hepatitis or Ebola and didn't work for either one. When COVID came and we looked desperately for any kind of treatment that might work, we looked at some of the medicines we had developed for other things to see if they would work for this. This medicine actually works to invalidate an enzyme that COVID-19 virus has to use to make copies of itself. It inserts itself into that enzyme complex and thereby stops it, and it stops making copy. So the final result is you make less viruses in your system, thereby becoming less sick for less long.
And would that be a sign of hope for a cure?
There have been several studies that have been done recently, and they had differing results. So some seem to say, like an article in Lancet, they just didn't feel like it worked. But another larger study here said it seemed like people got better quicker. And so a couple weeks ago, it was given emergency clearance to be used. There are a couple of caveats. One is they're suggesting it only be used for serious illness. And two, it can only be used in the hospital because of two things. First, it's an intravenous daily infusion. And secondly, there are some complications that can happen, things like affecting your body and respiratory distress that would need hospital available in case you had complications from that treatment. This is early on. We're basically authorizing to do something we don't have our normal thorough proof about, but desperate for a solution, we're willing to do things that might save lives or might keep people from more serious complications, even though we don't have the normal proof that we usually have for any other treatment. So this is something that's given an emergency temporary clearance, and it's actually going to be done for free by Gilead for all usages during this time. Once it's given permanent approval and more proof, it'll be sold as a more expensive medication across the country.
Perfect. And what are your thoughts as a doctor, the fact that they are releasing this drug for people to test it out across the country?
Yes, all over the country, there are cases where there's a sense of desperation and a sense of exasperation that we just seem to have so few resources. And this virus keeps doing new things. With children we've seen recently and other kinds of people with new kinds of complications. So there's a kind of a culture happening amongst physicians across this country and other countries that's constantly sharing with each other. I tried this, why don't you try it? Some of which are very simple things like, I tried vitamin D, or I tried this other medicine, or I tried this blood pressure medicine, and there's experimentation happening all over, and everybody's sharing what seemed to have worked, and you might try this, and this is how I did it. So this is probably our strongest tool we have right now that has the best limited evidence we have for an IV treatment for serious patients in the hospital that might make people get better quicker and hopefully keep them from having more high volume of virus that results in much more serious complications and death. So it's hopeful, but not a sure thing.
There's just so many things going on. From a doctor's perspective, what do you hope for in the future?
You know, having recently survived COVID-19 virus illness and having several patients who have gone through it as well, and knowing many colleagues who are dealing with this on a daily basis, I'm very longing for there to be solutions, some of which we're trying even without great data and research, but hopeful that they will save lives. But I'm expecting that over the next 2 or 3 months, we'll have much more information about several of the possible treatments that will give us a much greater armamentarium for fighting this and beating this. At the same time, we're working toward herd immunity that will develop across the country, and we're working toward a vaccine, which is still a longer thing off. But I'm feeling that every month that goes by, we have greater details, greater options that we have, and more proof of the options that are the best to choose.